Sex Talk, Erika Miley, 'cause sexuality is tough. And okay, sex just isn't good enough, no. Sex Talk with Erika Miley.
Hey folks, welcome to Sex Talk with Erika Miley. Erika Miley here, back for another week with all of you. And again, just you and me. I'm really excited about this. I've been super inspired to be kind of doing some solo episodes with all of you. So I hope, at least from the numbers, y'all are enjoying it. A little housekeeping up front. I do want to give a brand new shout out to all my Patreon folks who have jumped in to support the podcast. And for those of you who haven't yet, please come join the Patreon. It's patreon.com/Sex Talk with Erika Miley. Jack Hawley, Issa, Anton Smeltzer, EC Peacemaker, and Christopher Speed. I just want to give you another shout out because y'all are out here, new Patreons, contributing to the show, and it is so awesome and so amazing that you all are finding value in this. That being said, let's jump right in. Today, we are talking about vasectomies. Woohoo! Maybe I'm the only one that goes woohoo when you say vasectomy. Yet another peril of being a sex nerd, I guess. So I do want to talk about vasectomies today because I think it's really important, especially since there are not many opportunities for male-bodied folks to be able to have birth control other than the condom. And the condom, if you know how to put it on correctly, then it can be fairly effective at preventing pregnancy and STDs. But when it's not put on effectively, the effectiveness obviously plummets. So the vasectomy is a good option for some people to really eliminate any worries about getting someone pregnant. The thing to know about a vasectomy, though, is that it is not effective at preventing STDs, STIs, anything like that. So, that being said, I want to jump right into what it is. So, a vasectomy essentially is a form of male birth control. It cuts the supply of sperm to your semen. So, it is not that you will not have semen. It cuts the supply of sperm, the little swimmers themselves. It is done by cutting and sealing the tubes that carry sperm. Vasectomy generally has a very low risk of problems and can usually be performed in an outpatient setting under local anesthesia. So I don't want to make this seem small or have people in my DMs being like, you don't know how painful it was. You're a female-bodied person. How would you know? Like, I'm not trying to make this small at all. It is just listed especially when they're doing insurance billing, it is listed as an outpatient procedure. Vasectomy offers no protection, again, for sexually transmitted infections or diseases of any kind. So why is it done? Vasectomy is a safe and effective form of birth control. Fundamentally, that is why it is done. It is for those who do not want to father a child in the near future. And vasectomies, the wonderful thing about vasectomies is how effective they are. They're on par with IUDs and even more effective than that. More than anything can actually be 100% effective at preventing pregnancy. I hear you out there. I hear the stories from people. My partner had a vasectomy. There's no way I can be pregnant. And then a person can end up pregnant. These things can happen. And we'll get to that here in a minute about some of those complications that can happen with vasectomies. But generally speaking, it is 100% effective at preventing pregnancy. Again, the vasectomy is an outpatient surgery, low risk of complications and or side effects. The cost of the vasectomy is far less than the cost of female sterilization, or in other words, tubal ligation, or also known as getting your tubes tied. The long-term cost of birth control for medications for women is also significant in comparison to the cost of vasectomies. A vasectomy essentially means you won't need to take birth control steps before sex, such as putting on a condom. This is why it's done. So, some of the risks to know, and I think this is important. because there are risks. There are risks to any procedure. There are risks to the pill for female-bodied people. There are risks to IUDs. There are risks to anything that you are going to be using for birth control generally. So the potential concern with a vasectomy is that you might later change your mind about wanting to have a child. And it is possible to reverse a vasectomy. There's just no guarantee that it will work. A reversal surgery is more complicated than the original vasectomy surgery and can be pretty expensive and ineffective in some cases at reversing the surgery. Other techniques are available to father a child following a vasectomy, such as like IVF or in vitro fertilization. Oftentimes, though, these techniques are pretty expensive and not always effective as well. So before you get a vasectomy, be sure that this is what you really want and that you're certain that you don't want to have any children in the near future. The other thing to note is if you do have chronic testicular pain or testicular disease, you may not be a good candidate for a vasectomy. Many men, a vasectomy doesn't cause any noticeable changes or side effects, and serious complications are very, very rare. I will include the list in the notes. There is a list of side effects right after surgery. It's not all that long. A lot of times it includes bruising, mild sweating to moderate swelling, and sometimes infection, but I will include a longer list there in the show notes for you to take a look at. I think these are the concerns that I want to focus on right now for sure, because this is something that I hear about from clients, or I hear about it from clients' partners, that they have some of these concerns that are really unfounded and are myths that often go along with vasectomies. Many men worry that a vasectomy could cause serious problems, but these fears really, really, really are unfounded. So the first thing that I hear quite often is that it can affect your sexual performance. Many men will come to me and say, I don't want to have any more children. And we've talked about this, but I'm really concerned about my ability to be able to perform and get an erection. A vasectomy will not affect your sex drive or your masculinity in any way other than preventing you from fathering a child. Ultimately, that is the primary impact. Men often have reported higher sexual satisfaction after vasectomy, merely because psychologically the worry of pregnancy has been removed. The next thing I hear from people is that they are concerned that it might damage their sexual organs. There really is very little risk that your testicles, penis, or other parts of your reproductive system will be injured during the surgery. It is an outpatient surgery. It is commonly performed. In rare cases, injury to blood supply can lead to loss of a testicle. That is very, very, very rare. And doctors have to let you know, as in any other surgery, let you know what rare complications can happen. But it is very unlikely to happen if you have a skilled surgeon. So none of that going to the back alley, discount 5-for-1 vasectomies. You want your surgeon to be skilled. You want to go to somebody who you can trust. And then that way your worries can be abated. Increase your risk of certain cancers is sometimes a worry I've heard from people. There has been some concerns about possible links to vasectomies and testicular or prostate cancer in the past, but there is no proven scientific link between these two things. Sometimes people worry about a increased risk of heart disease. Just like with the cancer fears, this does not appear to be a problem, nor is it backed by any substantial research. Cause severe pain is the next and probably the thing that I hear the most that is coupled with the sexual performance worry, is that there will be massive amounts of pain and you will never recover from it. And you know, how many of us have worried about any kind of surgical procedure that we've had or that we will have? I would be concerned about you if you were not worried about having a surgery. It is cause for worry that you're going to be making a big decision and you are altering your body. Of course you should be worried. But when it comes to side effects, and more likely than not, you will have maybe some minor pain, maybe some tugging during the surgery, but severe pain is very, very rare. And likewise, after the surgery, you may have some pain, but for most men, that pain goes away in a few days. Many men have a few days off of work. Many of the men that I have encountered who have talked a lot about the pain and the swelling have not taken sufficient time off of work. That I'm man enough stigma will cause them to maybe make a decision about going to work sooner than they should have. And it's okay to stay home and heal. You just had a surgery. It's okay to stay home and heal. Put those frozen peas in your crotch and be able to not experience pain and feel so depleted by the experience that it makes it difficult to work. So it's good to know what to expect before you go. So, there's YouTube videos that are graphic. You can always go that direction, but also just making sure that you're doing good research on like who you want to see and trusting that that person is giving you proper information. And if you are unsure and if they are, get a second opinion and be sure to go to that initial appointment, get the consultation, and be willing to bring up your concerns and your worries. This is your body. You can bring up your worries with your doctor. Quick break from the action, folks. Action. I just want to tell you about my Patreon. Every week, I bring you guests and seriously, lots of sex nerdery. Help me keep doing that by becoming a supporter. What do you get in return? Cool perks. For real. I am going to be doing shout outs, stickers, a bunch of stuff. So check it out at erikamiley.com/Patreon. That's erikamiley.com/Patreon. I hope to see you and see more of you by becoming a Patreon. Thanks, guys. I think that's kind of a good place to kind of wrap up as far as at least the why and the worries about vasectomy. I do want to talk a little bit about the cost of vasectomy because sometimes, this is something that I hear from people a lot about insurance generally. Like I hear people say, well, my insurance won't cover my birth control, but it'll cover, Viagra or lots of the things that they get frustrated with their insurance about. But oftentimes birth control after, especially the Affordable Care Act, the birth control is often covered. The thing that is typically not covered though is a vasectomy. Sometimes though, it's not a requirement by the Affordable Care Act for vasectomies to be included in that. But many insurances can cover a vasectomy. It just depends. And the cost of it can be anywhere from $0 to $1,000 roughly, including those follow-up visits. And it depends on where you get the surgery. Planned Parenthood does offer the surgery. They offer like a sliding fee scale to those who may need to pay cash for this. So I encourage folks to take a look at their insurance policies to see if it's covered, but depending on your income, you may pay less than you would think for a permanent solution, birth control. So I think that's an important option to cover because sometimes people are concerned about the cost. Much like one of the things I hear from clients is they're concerned about the cost of like an IUD because an IUD can be very expensive depending on if it's covered by insurance or not. So that was a lot. That was a lot of information. I'm going to make sure that the links that the information that I used for this episode is in the show notes. So if you have any questions, you're more than welcome to take a look there or contact me directly. I'm happy to answer questions as much as I possibly can. And you can check out my website, Erika@erikamiley.com. If you are looking for mental health services, you can check out erikamiley.com. Also, the Center for Mental and Sexual Health.com. I have other therapists. If I am full, I have other therapists I can connect you with that have similar, if not the same training as I do. So that's like all the things for this week. Please, again, jump on Patreon. I'd love to have you. I'm going to be doing a monthly Q&A for those of you on my Patreon. So you can just ask me questions directly. It's going to be great. Oh, for those of you, just a quick reminder, those of you who are out there who are healthcare professionals who want to know more information about sex education or how our clients' sexual stories impact our own lives, I have a private Facebook group. It is for healthcare professionals. That means therapists, psychologists, ARNPs, doctors, anybody out there who's in the health field. We talk a lot in that group about how to manage things within ourselves and how to be the best resource we can for our patients and clients. So again, thank you all for sticking around to the end of this week. I hope you all have a wonderful week, and I will see you next time. Thanks for listening, folks. Please rate and review on iTunes. That helps this podcast get found. If you leave a 5-star review, let me know about it on any social media, and I'll shout you out on the podcast. You can find my website at erikamiley.com. You can find me on Facebook, the Gram, and Twitter. See y'all next time.